Hi, I'm Dr. Jim Lynch from the Stellate Institute in Annapolis, Maryland. One of the questions we get asked is about different levels of stellate ganglion blocks. We talk about the sixth cervical vertebrae level, which has been traditionally where the stellate ganglion block has been performed, and why some facilities and some physicians have started to block the cervical sympathetic trunk at both the C6 and the C4 level, or different levels. And people ask, what's that all about? Why are you doing that? So I think to answer that question, the first point is that when we say we're blocking the stellate ganglion, which is located down at about the C6 or C7 vertebrae level, what it is a cluster of nerves that lies along the cervical sympathetic trunk, which runs along both sides of the neck. Because that's the case, it's essentially a highway with a whole bunch of offshoots that travel between, essentially connecting the body to the brain, and all the fight or flight response travels down that highway. There's a tremendous amount of anatomic variation. So what we've discovered over the past couple of years and published in the peer-reviewed literature is that adding a second level block at about the C4 level, or fourth cervical vertebrae level, actually increases the success rate of the stellate ganglion block for treating post-traumatic stress symptoms. How does it do that, and why? People ask, it's the same nerve. What's the big deal? Why does blocking it in two locations matter? It really has to do with going back into the early literature and discovering all the anatomic variations. So really, one of my favorite things, just to show you this is the book published by Daniel Moore back in 1954 with these beautiful color plates that show all the anatomic variations. And these were demonstrated through cadaver dissections over the years to find that within the cervical sympathetic trunk, there's a tremendous amount of variation, both in the locations of the ganglions and in terms of the connections to between the brain and the body. So the short answer is there's a tremendous amount of anatomic variation. By adding adding a second block at the fourth cervical vertebrae level, in addition to what's traditionally been done at the sixth level, we simply increase our success rate. And that's what's been demonstrated in practicality, and why we perform that routinely now, unless there's some reason why that doesn't make sense, which is quite rare that there's a reason such as an anatomic reason that would prevent us from blocking the cervical sympathetic trunk at both C6 and C4. So that's pretty much become our standard practice here at the Stellate Institute. Hope that answers your question. Thank you.